On the second floor of the Heart Hospital and to the left as you exit the elevators is the new surgery waiting area, providing family members of all of the medical center's surgical patients a comfortable place to reside while waiting for their loved one. Across the second floor lobby from the elevators, visitors will find a new cardiovascular intensive care family lounge. The family lounge has wireless internet access, a coffee bar, and TVs, providing a comfortable and easily accessible area for families who may have to leave the bedside while procedures are being done. During peak hours, the lounge will be attended by a Heart-Lung Vascular Institute family ambassador, which is staffed by individuals donating their time as medical center volunteers. To the right, as you exit the elevators, visitors will be greeted by an inspirational, one-of-a-kind tiled floor wall featuring a mural called Heart Saver. The Heart Saver mural will provide an elegant and calming entrance into the new Cardiovascular Intensive Care Unit, the CVICU. This new CVICU, encompassing the entire second floor of the Heart Hospital, has 24 large private patient rooms for the medical center's cardiology, cardiac, and vascular surgery patients, and has been designed to provide maximum care for both our patients and their families. Recent guidelines for hospital construction require private patient rooms as described by the Healthcare Advisory Board and the Society of Critical Care Medicine. Private rooms are associated with a lower incidence of hospital-acquired infections, decreased auditory stimulation, and increased patient privacy. Each room will have private bath and restroom facilities and a sofa. The sofa will convert to a one-person bed for overnight stays by a family member. Family support is an important aspect of holistic care for the patient and has been linked to better outcomes and decreased length of stay. Patients report higher levels of satisfaction with aesthetically appealing private rooms. Each room will have a window, allowing exposure to natural light, which can reduce confusion and anxiety in critical care patients. The color themes and decor of the new CVICU were selected because of their calming and healing traits. The focus is on earth tones and colors found in nature. You will see that the color themes in the new unit are consistent with the decor in the Heart-Lung Vascular Institute building. One of the most appealing components of the new CVICU unit is the cozy respite area in the hallway overlooking the lobby, which displays a lighted feature wall and custom chandelier. There will be a coffee bar for families and bench seating overlooking the lobby if the family members want to have a change of scenery. Centralized core staff stations along with nurse station alcoves located outside each patient room will allow for individualized nursing care. The size and layout of the patient rooms are designed to bring the caregiver to the bedside. Charting will be done either in the room or directly outside the room, allowing visualization of the patient at all times. Current staff members in CVICU have played an integral role in the planning and decision-making processes that have occurred while building the new unit. The focus has been on assuring an environment of patient and family-centered care. The staff has participated in decisions about the communication system in the new unit, new patient beds, and the Latitude boom arm system found in each patient room. The Latitude system's telescoping arm allows for patient and services positioning most anywhere in the room. Patients can get up into the chair and even walk into the bathroom while still being monitored and maintaining oxygen and IV fluid delivery. This system also allows head-of-the-bed access to be easier than ever. Each room will contain a nurse server, which allows the nurse to have supplies readily available and will eliminate wasted time searching for and retrieving supplies. The Joint Commission requires that floor space allocated for each bed should be sufficient to accommodate all equipment and personnel that might be necessary for patient care. In addition, there are other considerations and requirements for coronary patients, including private rooms and access to a toilet in the room. Healthcare has experienced significant advances in technology, leading to an increase in longevity and a decrease in mortality. 1 person out of 3 will experience some form of cardiovascular disease, and the Heart, Lung, and Vascular Services has seen significant growth. The opening of the 24 private CVICU rooms will help us to accommodate patients in our region who need our care. From being equipped with the latest technological advances to helping deliver optimal care to the visually appealing entrance and public areas, the Heart Hospital will serve as the region's epicenter for cardiovascular and pulmonary health, and as the prized centerpiece for the University of Tennessee Medical Center. When it opens, the Heart Hospital will mark the first new inpatient building constructed on the Medical Center campus in more than a quarter of a century. With a rich history of utilizing evidence-based practices to ensure that we're delivering the highest quality of care available, the Heart Hospital represents a continuation of that commitment to the patients of the Medical Center's Heart-Lung Vascular Institute. To serve through healing, education, and discovery. It's who we are. The University of Tennessee Medical Center. Wisdom for your life.